Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating case study that highlights the innovative approaches being taken in veterinary medicine to combat severe illnesses in our canine companions. This study, published in the Journal of the American Animal Hospital Association in 2024, details the successful treatment of a dog suffering from both immune-mediated hemolytic anemia, or IMHA, and acute bilirubin encephalopathy, also known as ABE, through the use of plasmapheresis. Our story begins with an 8-month-old mixed-breed dog who presented with pale mucous membranes, a clear indicator of underlying health issues. The dog was diagnosed with intravascular IMHA, a condition where the body's immune system mistakenly attacks and destroys its own red blood cells. Traditional treatments were initiated, including corticosteroids to suppress the immune system, medications to prevent blood clots, a transfusion of packed red blood cells to combat the anemia, and intravenous immunoglobulin to modulate the immune response. However, the dog's condition took a turn for the worse. She developed severe hyperbilirubinemia, with total bilirubin levels soaring to 48.1 milligrams per deciliter. This extreme elevation of bilirubin, a yellow pigment produced during the breakdown of red blood cells, led to a critical complication, acute bilirubin encephalopathy. The dog's neurological state deteriorated rapidly, leading to stupor, intermittent opisthotonos, which is severe muscle spasms causing the back to arch, forelimb extension, and an absent menace response, indicating significant brain dysfunction. Faced with this dire situation, the veterinary team turned to an advanced treatment option, centrifugal plasmapheresis. Plasmapheresis, also known as therapeutic plasma exchange or TPE, is a procedure that involves removing plasma, the liquid part of the blood, and replacing it with replacement solutions. This technique helps to clear the blood of harmful substances, such as autoantibodies and immune complexes, that contribute to IMHA and the buildup of bilirubin that causes ABE. The dog underwent an initial protocol of 3 TPE treatments, each spaced 24 hours apart. While there was some moderate improvement in her neurological status, the persistence of autoagglutination, the clumping of red blood cells, and ongoing hemolysis indicated that the initial treatment was not sufficient. The decision was made to proceed with a 4th TPE treatment on day 6. The morning after this 4th treatment, a significant breakthrough occurred. The dog was autoagglutination negative. Her neurological condition gradually improved, and she was eventually discharged from the hospital on day 12. Remarkably, the dog made a full recovery and remained neurologically normal, continuing to thrive at home on a single maintenance medication, mycophenolate. This case is particularly significant because it demonstrates the potential for continued plasmapheresis treatments to achieve positive outcomes, even when initial treatments appear inadequate. Prior to this report, there was no documented case of a dog with IMHA and ABE successfully recovering after more than 3 TPE treatments. This success underscores the importance of not giving up in the face of severe, persistent disease and considering extended TPE therapy to stabilize critically ill patients. The plasmapheresis procedure itself is a complex undertaking. In this case, the veterinarians used a centrifugal TPE treatment, which involves using centrifugal force to separate blood components. The process involves exchanging plasma with the goal of removing a significant portion of the circulating autoantibodies. For this patient, because of her anemia and small size, the extracorporeal circuit was primed with a combination of packed red blood cells, fresh frozen plasma, and saline solution to improve hemodynamic stability during the procedure. Regional citrate anticoagulation was used to prevent blood clotting during the procedure, and a continuous rate infusion of calcium gluconate was administered to maintain stable calcium levels. The replacement volume consisted of a mix of fresh frozen plasma, and a balanced electrolyte solution. Careful monitoring and management of the patient's blood pressure, potassium levels, and other vital parameters were crucial throughout the treatment. Several challenges were encountered during the TPE treatments. Blood clotting in the circuit was a recurring issue, requiring adjustments to the anticoagulation strategy. Additionally, the patient experienced episodes of hypertension, bradycardia, and hypokalemia, all of which needed to be promptly addressed. The successful outcome in this case was not solely due to the plasmapheresis treatments. The dog also received a comprehensive array of supportive care, including blood transfusions to combat anemia, medications to prevent seizures, gastrointestinal support, and empirical treatment for potential infections. Immunosuppressant medications, such as mycophenolate, were also administered to help control the underlying immune-mediated hemolytic anemia. This case report has several important implications for veterinary medicine. It adds to the growing body of evidence supporting the use of plasmapheresis as a valuable tool in the treatment of severe IMHA and AB. While the 2019 American College of Veterinary Internal Medicine consensus statement on IMHA acknowledges TPE as a potential treatment option, this case provides further evidence of its effectiveness, particularly in cases where traditional therapies have fallen short. Moreover, this report challenges the notion that 3 TPE treatments are always sufficient. It demonstrates that continued TPE treatments can lead to positive outcomes, even in patients who do not initially respond to the standard protocol. This finding is particularly relevant given the high mortality rate associated with severe IMHA and AB. There are, of course, limitations to this case report. The lack of advanced brain imaging makes it impossible to definitively rule out other causes of the dog's neurological signs. Additionally, the potential for centrifugal TPE to contribute to hemolysis in dogs with IMHA remains a concern. Despite these limitations, the successful outcome in this case provides valuable insights into the management of severe IMHA and AB in dogs. The decision to pursue plasmapheresis in this case was influenced by a previous report of a dog with AB secondary to IMHA that was successfully managed with membrane-based TPE. This highlights the importance of sharing successful treatment strategies and building upon the existing knowledge base to improve patient outcomes. The authors of this report emphasize the need for increased awareness among the veterinary community regarding the potential benefits of plasmapheresis. By recognizing that positive outcomes are still achievable with continued treatment, even when initial efforts are unsuccessful, veterinarians can potentially save numerous lives. This case serves as a reminder that in the face of severe and life-threatening diseases, innovative and persistent approaches can make all the difference. In conclusion, this case report underscores the importance of considering plasmapheresis as a treatment option for severe cases of IMHA, especially when complicated by AB. It demonstrates that an inadequate response to initial TPE treatments should not necessarily be a deterrent, as continued treatments may still lead to complete resolution and recovery. By embracing advanced therapies and remaining committed to providing ongoing support, veterinarians can improve the odds for even the most critically ill patients. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.